Good morning. My name is Jasmine Smith. I'm a student nurse at MCC. Today I'm going to be doing a full body assessment. I'm going to wash my hands real quick before we get started. Okay. Can you tell me your name and date of birth?
Lauren Waits, 8/26/99.
Okay. Can you tell me what day of the week it is?
Thursday.
Okay. And do you know who the President of the United States is?
Biden.
Okay. Are you comfortable? Do you need to go to the restroom before we get started?
No, I'm comfortable.
Okay. How you feeling?
Oh, good.
Okay. All right, well, let's get started. I'm going to start by looking at your pupils. So I'm going to dim the lights. Okay, I want you to just look straight at the wall for me. Okay, I'm going to turn the lights back on. Now let me assess your mucous membranes. You can just open your mouth. Thank you. Okay, now I want you to follow my pen line, okay? Very good. Okay. Let me ask you this. Are you in any pain today?
I'm not.
Okay, so on a scale from 0 to 10, how would you rate that?
0.
Okay. Alrighty. Well, let me feel your carotid pulse. Okay. I'm going to go down. I'm going to assess your arms. The skin is warm and dry. I'm going to check your capillary refill. Okay. Returns within 3 seconds. Okay, I'm going to feel your radial pulse. Just move your little scrunchie here. Okay, now I'm going to go down and feel your brachial pulse. Okay, can you squeeze my fingers? Okay, now I want you to push against my hands. Okay, now I want you to cross them and I'm going to try to pull and you just resist me, okay? Okay. Your skin turgor is prompt. Your skin. Okay, and now I'm going to listen to your heart sounds.
Okay.
We're going to start with the aortic. And the pulmonic. Okay, and then the tricuspid. And the mitral. I'm just going to come up here. Okay, now I'm going to listen to your breath sounds. Just breathe normal for me. I'm just going to lift your shirt here. Okay, I'm going to comb in your sports bra just a little bit. Okay, I'm going to come up under again. Okay, now I'm going to listen to your lateral breath sounds. I'm going to come up with your shirt again on the side here. Okay. Okay, I'm gonna go to the other side. Do the same thing. Okay, now I'm gonna listen to your posterior. If you'll just sit up for me, and I'm gonna move your hair and pull your shirt back up so I can get to that area. Okay. Okay, very good. You can lay back for me. Okay, I'm gonna raise your stomach so I can look at your abdomen. There's no obvious, I'm just gonna pull your pants down just a little bit. There's no obvious bulging, no lesions. Have you had any pain or tenderness in your stomach? Okay. When's the last time you had a bowel movement?
Yesterday.
Can you tell me how it looked? Can you describe it for me?
It was normal, soft.
Within your normal limits,
Yeah.
was it round or hard? It was just soft.
Just soft.
Okay. What about urination? When's the last time you went to the bathroom?
About an hour ago.
Okay. Can you describe that for me?
It was normal.
Okay. What color was it?
Clear.
Clear. Did it have just solid clear, or did it have any color to it?
A little yellow.
A little bit yellow. Okay. I'm just gonna look at it and then I'm gonna listen to it.
Okay.
Listen to all 4 quadrants, your bowel sounds. I'm sorry. Okay. I'm gonna start down here. Okay. Now I'm just gonna push on it just a little bit. It's called palpating it lightly. So if you have any tenderness or pain while I'm doing that, you let me know, okay? Very good. Okay. I'm gonna feel right here at your femoral pulses and see if I can feel them, okay? Raise your shorts. I know that's kind of uncomfortable. I can't feel them with my fingers. We can always use a Doppler to feel those and make sure. But I'm going to assess the bottom half of your body. And if I can feel them there, then we know that they're there, okay? We're going to feel the popliteal pulses. Okay. Now I'm going to feel your posterior tibialis pulse. Very good. And your dorsalis pedis pulse. Okay. Your lower extremities are warm. Skin's intact. There's no redness, swelling. There's no edema in the calves. Skin turgor is prompt. Capillary refill was within 3 seconds. Okay, I want you to pull against my hands. Okay, now push. Okay, and can you pick your feet up? Very good. Okay, I'm just gonna have you roll that way for me, and I'm gonna set your back and buttocks, okay? Okay, there's no redness, there's no swelling on the bony prominences, there's no blanching, no skin breakdown. Okay, you can roll back over for me. So you're 21. Have you had your first pap smear yet?
Yes.
You have? Okay. I don't guess you got to tell me what it was. Most healthy females that are your age at 21, as long as they're normal, you don't have to go but about every 3 years. But if you have any abnormals, you need to go about once a year.
Yes.
How's your diet usually?
I try to eat healthy.
You try to eat, okay. If forever you need somebody to help you with that, we do have nutritionists that are available.
Mm-hmm.
Do you smoke?
No.
Okay. Do you exercise?
I try to, a couple times a week.
Okay, we recommend that you exercise about 3 to 4 days a week, 4 to 5 for about 30 minutes a day. Okay. She doesn't have any O2 hanging. She doesn't have anything that could wrap up around her. If she did, we would document the liters that it's going at. She doesn't have any wound vacs that are going to her for us to assess that. I would assess her IV lines or her PICC lines if she had any in her hands to make sure there's no redness, edema or swelling in that area. I'm going to put your call bell near your bed. That way, if you need anything, you just call me and I'll come in. Whatever you need. We're going to put the side rails up. We're going to lock the wheels and put you in the lowest position so you don't fall out of bed on me, okay?
Okay.
So you just call me if you need anything.
All right. Thank you.
All right. Thank you.